Happy April the 11th, everyone. What I wanted to do was send out a video update, clinic update, in lieu of a new printed newsletter or a written newsletter. So I want to see if this format works, and if you feel that it is effective, please let me know. I have my notes right here. I want to cover this. April 11th. So first off, shout out to my cat, Lola. It's her birthday. Not sure whether she's 8 or 9. Born in Mississauga. We rescued her from there, and she's had a wonderful experience. And anyway, she'll always be a kitten to me, so try to spoil her today. I'll be in clinic in Barrie, April 14th to the 25th. So we'll be seeing patients both online and in person in Barrie those 2 weeks. In terms of chiropractic appointments, they will also be available. But I wanted to sort of make a note here. Spinal decompression, class 4 laser therapy is always available through our clinical assistants and our IV techs. So if you think those are a service to you, please reach out to the clinic. I will say, however, that we are trying to find the chiropractor, the right fit for our team. I'll talk about what that right fit looks like at some other point, not for the sake of today's newsletter. I'm proud of is we've created an online booking for consultations with our team. If you go to wellnessdoctor.janeapp.com, you can book yourself for a follow-up with an existing patient or a new patient for supported cancer or functional medicine online. And you can do that directly. And we are doing that same schedule is being maintained wherever I am traveling, so we can create consistency in patient care. We're piggybacking on that schedule in the US side to create this Integrative Oncology Associates. Now, Integrative Oncology Associates will provide supportive cancer care anywhere in the US, all 50 contiguous US states. And we partnered this past month with Guardian MD. Big shout out to Dr. Chris Seitz, CEO of Guardian. And this is massive. So our team does the intake. Again, you'll be able to book online. Our team will do the intake, and we will be able to provide supportive cancer care through Guardian MD. And that team will then, after our intake, will do a good faith exam. They will do the prescriptions and send those to the respective IV clinics or off-label medications or mistletoe, etc., and whatever's required for supportive cancer care. And this is huge cost savings in terms of even getting off-label medications for supportive cancer care. When I say off-label medication, things like metformin or atorvastatin or a doxycycline, through a lot of third-party oncology clinics online in the US is exorbitant. Patients are being absolutely, in my opinion, exploited. So we found a way to sort of reduce the cost for that, and through our partnership with Guardian MD, which is amazing. It was absolutely amazing. Clinic closures. April 18th, Good Friday. Barrie Clinic's closed. Jacksonville Clinic is open. Our nurse, Natalie, in Jacksonville, phenomenal. The Easter Basket Bundle. This is what I was told. So Easter Basket Bundle includes 2 Lifestyle IB drips, 2 IM quick shots for only $300. Great deal. And NAD update. We are doing NAD in the US, obviously. Our pharmacy team is still working on finding a clean source of NAD that fits our standards. So stay tuned for that. General franchise update in terms of our franchising in Canada. We have now 13 signed franchises. This is a huge deal. So big shout out to our CEO, Ben Crosby, but specifically to our Canadian franchising team, our president, Danny Gramanopoulos. Buddy, you're knocking us out of the park. You and your team are like really world-class franchisers. And anyone who has experience or had experience working with Danny will know that. He's been one of Canada's most successful franchisors. And as many of you know, I am bullish on this industry. I don't want to say the wave of the future, but it's a modality that is so valuable and so misunderstood and not reproducible. BC seems pretty well represented. Alberta has, I think, 3 clinics or 2 clinics signed franchises, or 3 maybe. Ontario is now emerging, but it still blows my mind that places like Vaughan, Port Credit, downtown Toronto, Aurora are still uncalled for, so or still haven't been, no one's put their name on that list. So if you have an interest in this IB franchise, specifically in Ontario, it's wide open. Famcast on Kajiko. So the amazing Margaret Wallace Duffy. I'm back in studio. So we've had a lot of positive feedback on our 3 episodes that we did for Halton Region for the TV show. So they've asked me to come back in studio. We're going to do a rapid fire. So if there's questions or there's themes or there's topics from an integrated or functional medicine perspective that you want us to cover on those episodes, put a link in. Leave it as a comment, send it as a message, reply to this email if we're sending this out also as an email. We'd love to hear from you. Lastly, what I did this past month, I started wearing a Whoop because I wanted to improve my heart rate variability. And heart rate variability is a very important biomarker. And again, I want to do a special shout out again to Dr. Richard Nahas,
who implemented, when we were doing health score back in 2002, 2003, heart rate variability testing. So we were doing heart rate variability testing 22 years ago, and people are now only starting to use it, but now it's a wearable technology. I really wanted to improve my heart rate variability. One thing that I've noticed is the day after I have an IV, my HRV goes up, which is a positive metric. That's a good thing. 2 patients said the same thing this past week, one the week prior, which has really piqued my interest. So if you happen to have a Whoop wearable technology, if you use IV hydration therapy or IV vitamin therapy, and you notice a change, I want you to reach out to us. I'm contemplating doing a research study with our medical students, looking at HRV and other biometrics, or how vitamin IV therapy affects biometrics like heart rate variability. Anyhow, that's the update. Hope this is a useful way to sort of share news, and have an amazing month. Happy Easter. And I look forward to seeing everyone back in Barrie or in the US when we're back here.